provided $228 million of indigent care to Virginians, the majority of whom are members of the Commonwealth workforce, would be considered part of the coverage gap. We take care of patients from every legislative district, and so we are a statewide safety net hospital. Our College of Law is located in Southwest Virginia, and we provide $5.9 million in indigent care in that part of the state. We've looked at the districts that all of you represent and totaled up the amount of indigent care we provide your constituents, and it was $94.5 million last fiscal year. The Affordable Care Act mandates eliminating the disproportionate share payments that support indigent care at UVA, but also at VCU. The university can't shoulder these costs without another postponement at the federal level or another mechanism to financially support this care. At the same time, we believe we need to focus efforts on reforming the current system of healthcare delivery. That's a long-term solution to improving health outcomes and reducing costs, and it requires that the provider community be involved in the improvements. Last fall, I hired Dr. Rick Shannon as Executive Vice President for Health Affairs. He served as chairman of the Department of Medicine for the University of Pennsylvania Health System previously, but he's also widely recognized for his work on patient safety. In Pennsylvania, he was on the governor's special panel for patient safety and was a member of the technical advisory group of the Pennsylvania Healthcare Cost Containment Council. His leadership and experience in patient safety will be critical in improving care and reducing costs in Charlottesville. And we're willing to share these practices to help accelerate long-term solutions. In closing, thank you for your continued support of UVA and all of higher education in Virginia.
Thank you, Madam President. Now, next speaker is Maria Marcus-Tony. She is an MD, Market Chief Medical Officer of Richmond Hospital.
Pretty close. Good afternoon, Chairman and the Senate Finance Committee. Thank you for the opportunity to speak to you today. My name is Saria Sotosio, the Chief Medical Officer for the market of the South Central Virginia region for Life Point Hospitals. I'm also an active member of the Virginia Hospital and Healthcare Association and the Medical Society of Virginia, and as such, I wear two important hats. Like many other small rural communities, Danville Regional Medical Center and Memorial Hospital of Martinsville are two of the largest employers for the region. We're committed to ensuring the delivery of needed health care to all members of the community, regardless of their ability to pay. In 2012 alone, the cost that DRMC, Danville Regional, provided health care regardless of that ability, given away care, was more than $12 million, and Martinsville was $5.3 million. Closing the coverage gap has significant impacts statewide, as you are aware. We're familiar with the 250,000 or 250,000 Virginians that earn too much to qualify for Medicaid, yet too little to be provided subsidies for care that's affordable and within reach. Increasing coverage would enable these patients to get less expensive care in the most appropriate setting, the right care in the right place, which starts with primary care. Currently, the costs of caring for the uninsured have to be covered in another way, much of it absorbed by individuals and businesses who buy health insurance. The shifting cost businesses an average of $240 per insured Virginian. That's in addition to the new taxes of $2.9 billion a year and provider cuts, including the Affordable Care Act. We pay those irrespective of your decision on closing the coverage gap. Virginia could help mitigate these losses by returning $6.9 billion between 2014 and 2018 through covering and closing this gap. As a physician and the Chief Medical Officer of the community, we see firsthand, and I could name off several examples of patients who receive their care in the emergency department or just too late. Dr. Gary Miller, a cardiologist in Danville, Virginia, will tell you he sees numerous patients who by the time they get to the hospital, sometimes way too late, and others to the point where they're no longer able to work because of the heart attacks they suffered at home for fear that they can't afford their bills. The number of patients that we send to the University of Virginia for a colonoscopy screening because there are no physicians who can afford to take care of patients in their office because they're saddled with the cost of taking care of patients within the walls of the hospital when they're on call, and that's about all that they can afford. Additionally, I constantly face the challenges of recruiting new caregivers to this rural community. One of the first thoughts is, how can we afford to take care of the folks that live here without the coverage of services that we know they need? What some people don't understand is that the coverage gap is just one component of our fiscal challenges of the healthcare system. We're facing other significant cuts through sequestration and elsewhere, and we've already taken significant steps to address these cuts and to prepare for the future of healthcare delivery. Next year, the Danville Regional and Memorial Hospital will incur an estimated $11.6 million in federal cuts, and in 2016, more than $13.1 million. That number continues to climb due to the Affordable Care Act and other Medicare cuts. That's nearly $25 million over 2 years. This means jobs, services, and community benefits are at risk. In 2012, Danville Regional contributed over $15 million in uncompensated care, community benefit programs, in addition to taxes paid to this community. In addition, the hospital's payroll of more than $72.8 million and capital investments of over $4 million contributed significantly to the Danville, Pennsylvania county's economic success. In 2012, Memorial Hospital contributed over $8 million in uncompensated care, community benefits, and taxes. But most importantly, and nearest and dearest to my heart, is our pipeline for primary care and healthcare providers in rural Southside Virginia, and that's our residency program. We started in 2010 to create a pipeline for care to all patients. In the clinic that our family medicine residents see patients for free, or $30, or what we can afford to give to them. Without this pipeline of care and without continuing to provide Medicaid expansion, we are at a loss of continuing programs that we have a loss of over $500,000 in the residency program alone, along with other service lines that we must consider. It's absolutely critical to Danville Regional Medical Center, Memorial Hospital, and the communities we serve that Virginia find a path forward that closes the coverage gap and returns Virginia's dollars to Virginia. Thank you.
Next speaker is Bill Downey, CEO of Riverside Health.
Chairman Colgan, Chairman Stosh, honorable members of the Senate Finance Committee, thank you for the opportunity to speak to you today. I am Bill Downey. I'm the President and CEO of Riverside Health System. We're a not-for-profit health system headquartered in Newport News, Virginia, but we serve the entire Eastern Virginia. And I come before you not only speaking on behalf of Riverside Health System as a provider, but also as Riverside Health System is one of the largest employers in the Commonwealth. Riverside employs more than 10,000 people. We have more than 500 physicians, nurse practitioners, and PAs in our medical group, and we're one of the largest, if not the largest, provider of non-acute services in the Commonwealth. Non-acute services being long-term care, continuing care, retirement communities. We have behavioral health, home health, hospice, and PACE programs. Our PACE programs serve the Peninsula, Petersburg, Richmond, and now Charlottesville. We're also one of the most integrated health systems recognized in the country, and I think it's fair to say, since we're not in Colorado, we've also been recognized as one of the most quieter health systems for 9 years in a row for our electronic health records. We also have a very strong commitment to quality and safety, and I will share with the staff a letter from the Premier that talks about the efforts not only of Riverside, but of Green, Nova, Valley Health, and Mons Coors around readmissions, hospital-acquired infections, things that are critically important. So we've been working to reform healthcare for many, many years, and it's something that is vitally important as we move this process forward. I support the expansion of Medicaid, the coverage gap, for many reasons. First, providers have been paying for this through reduced reimbursement for many years. We also, as I mentioned, have been working very hard and been engaged in healthcare reform, the duals, Medicaid, Medicare duals program that we piloted here in Virginia, patient-centered medical homes, home-enabling technology, telehealth, any number of things that work to keep people out of the hospitals, out of the emergency departments. It's also important, not to leave, for us, when you think about why it's important, is we as Virginia taxpayers are paying for this coverage expansion. We need to bring this back to Virginia. Businesses, as a large business employer, here's a study that shows businesses pay about $250 per insured person for covering the uninsured. We need help, not only as a provider, but as a business. It's also important for the people, the hundreds of thousands of people that will receive this coverage. They're mostly working, they're mostly healthy. If we can get them into patient-centered medical homes, we can keep them from getting chronic conditions, or we can help them manage their chronic conditions, and that will help the Commonwealth in the long run. It will keep them from going into those fast-growing areas of dealing with the aged and disabled. Riverside serves Eastern Virginia, but we serve very distinct communities. We have very rural communities to very urban communities. And I'd like to just talk briefly about Shore Memorial, the Eastern Shore. We became a part of the Eastern Shore 5 years ago. The hospital is in need of replacement. We are in the process of finalizing those plans. It's in the wrong space in terms of the population of the Eastern Shore, but it's also in a building that's 50, 60 years old, and the previous owners did not have the wherewithal to keep it up. When you look at the Eastern Shore, the unemployment rate is 2.5 to 3 times higher than the Virginia average. The poverty level is over 20%, and the average in Virginia is 12%. The Medicaid and Medicare mix that comes into our hospital is 15 to 30% higher, depending on the metric, either patient days or admissions. And we're faced with, had a board member ask 2 weeks ago, is this the right thing to do? Should we be spending this money to replace this hospital? It's a great question. In these uncertain times, can we afford to do that? I think we have to ask ourselves that. Can we do that? Should we look at a smaller facility? Do we phase it in? And what that means is it's fewer healthcare jobs, it's fewer jobs in the community, it's fewer construction jobs. So this issue of expanding Medicaid, covering the gap, is not only a health issue, it's an economic and jobs issue. We appreciate the Senate's support in the past. We would certainly hope for your support in the future. Thank you for your time.
Thank you, County. Next speaker is Sean Murray. I'm going to take Sean Murray. He's VP and CEO of Johnson Memorial Hospital, Medicine, Mountain State Health Service.
Co-chairman, members of the Senate Finance Committee, thank you for allowing me to speak to you today about the state of healthcare in far southwest Virginia. Actually, it sounds very similar to what Dr. Sikosi just described on the south side. As I indicated, my name is Sean McMurray. I reside in Abingdon. I'm Vice President for Mountain States Health Alliance and the CEO of Johnson Memorial Hospital in Abingdon. By way of brief introduction, Mountain States Health Alliance is a not-for-profit healthcare system based in Johnson City, Tennessee. We operate a family of hospitals, 14 of them, serving a 29-county, mostly rural area in a 4-state region. In Southwest Virginia, we operate 5 hospitals, including one that's a 1-bed critical access hospital in Dickinson County. Johnson Memorial Hospital is a 116-bed facility located in Abingdon. We employ approximately 750 team members. In addition, we have approximately 150 physicians on our medical staff. I stand before you strongly supporting a path forward to close the coverage gap by bringing Virginia dollars back to Virginia. As you know, approximately 250,000 uninsured Virginians earn too much money to qualify for Medicaid, but too little